we're going to identify structures, no, of the thigh region for this particular plastinate. This is more well dissected compared with the plastinate in the previous videos. We're at the area of the femoral triangle here. The sartorius muscle was transected. We can see structures, no, that are covered, no, by the sartorius. The hip joint is also partially open. This muscle that was transected here, that will be the iliopsoas, no, muscle. So you can actually see the femoral head right here. So this one is the rectus femoris. It's also transected, and vessels, no, that are more visible right here will be the lateral circumflex femoral artery and the deep artery of the thigh, or the profunda femoris artery. We can also see right here the pectineus muscle, no, was transected, and the distal segment was retracted. So the adductor brevis is more visible, no, plus its nerve supply. This one again is adductor longus, and then we can see right here the femoral artery. We have the saphenous nerve. This one is vastus medialis, then vastus lateralis right there. We have the gracilis, and then adductor magnus. So the adductor hiatus is right there. You can see the femoral artery passing through the hiatus, and it will emerge, no, as the popliteal artery in the area of the popliteal fossa, no, after passing through the hiatus. Let's look at the posterior compartment structures now. On the medial aspect, you can see right here the semi-tendinosus, no, more superficial to the broader muscle, which is semi-membranosus. We have the biceps femoris right here. You can see the sciatic nerve and its distal branches, no, the tibial nerve and the common peroneal nerve. Common peroneal is also called the common fibular nerve, no? And let us look closely at the popliteal artery right here. You can see branches, no? One going laterally, that's the superior lateral genicular branch of the popliteal, while the other one is the superior medial genicular branch. The genicular arteries, genicular, genus, no, it refers to the knee, so it supplies structures right here, no, in the knee region, including structures, no, forming the knee joint. You can see the diamond-shaped popliteal fossa right there. So let us identify some muscles found in the proximal leg. We have the head of the gastrocnemius right there. This one is the plantaris muscle. Deep to the gastrocnemius, we have the soleus. Let's move to the lateral aspect. This nerve, once again, is the common peroneal or common fibular nerve. It is superficial in position. Remember the ulnar nerve of the elbow, which crosses the elbow joint. It is the counterpart of the common peroneal or fibular for the upper limb. So just like the ulnar nerve, which is prone to trauma, the peroneal or fibular nerve here is also the most commonly traumatized nerve of the lower limb. That is partly due to its position also. It is found on the lateral aspect of the leg. So it's quite exposed to traumatic forces. When someone gets hit, if a person is hit by a motorcycle, for example, so the trauma is applied lateral to the knee, lateral to the posterior leg. During contact sports also, football, American football, or European football or soccer, this nerve will accidentally get injured when someone tackles the athlete from the sides, or during football or European football game, soccer. The person gets kicked at the lateral aspect of his leg. You can also see the knee joint, which is partially open right here. The capsule has been opened again. You can see the femoral condyles, medial and lateral. The epicondyle is on this part right here, and the anterior cruciate ligament, that's barely visible right there. We can also see the meniscus, part of the articular cartilage resting on top of the tibia. We have the lateral meniscus right here, and the medial meniscus on this side.